Coco Chanel once famously said, "Fashion is not something that exists in dresses only. Fashion is in the sky, in the street." This quote is from 1969. 5 decades have passed since, and now fashion has made its way to medical prescriptions. To explain what I'm talking about, let's go back to the Met Gala last year. It saw a range of skinny, high-fashion celebrities like Kim Kardashian. She wore the iconic Marilyn Monroe dress and lost 7 kilos in 3 weeks to fit into this dress, which is horrifying. But for those desperate to lose weight, it screamed goals. Within a week, Google searches for Ozempic spiked to an all-time high. Of course, correlation does not equal causation. Though experts cannot help but connect the dots, Ozempic has quickly become famous as a celebrity skinny jab. It's a TikTok trend. #Ozempic has more than 160 million views on the platform. Terrifyingly, there's even an Ozempic TikTok challenge, and now the drug is flying off the racks. Ozempic is a type 2 diabetes treatment. It is prescription medication, which patients self-inject once a week. This drug was first released to public in 2018. Back then, 92% of its users were diabetic. In 2021, this share fell to 77%. Do you know why? Because now the drug is increasingly being used for another purpose, and that is weight loss. This is a famous side effect of the drug. People are aware of this. They want to lose weight, so they're injecting themselves with diabetes drugs. And pharmacies are more than happy to oblige, especially online pharmacies. They're giving Ozempic and other similar drugs off-label, meaning prescribing medicines for a different condition than their original purpose. It sounds shady, but it's completely legal and fairly common. In Ozempic's case, what is the result? Diabetic people are not getting their medicines. There is a shortage of Ozempic in the UK, for example. People living with diabetes are scrambling to get their hands on the drug. They're ringing up pharmacies, some even begging them, because many are going months without their dosage. This has serious clinical implications for diabetic patients. They need this drug, Ozempic. Meanwhile, who are getting the drug? Who are the people who are getting the drug? People who merely want it for cosmetic purposes. Sure, Ozempic and other weight loss drugs are necessary in some cases, like when weight gain and obesity poses threat to life. But that's not why these drugs are flying off the racks. People of a healthy weight are getting prescriptions for Ozempic because they want to slim down, and this is completely unacceptable. But it's not even the worst part. People are left with problematic side effects like nausea, vomiting, diarrhea, constipation, stomach paralysis, depression, even suicidal thoughts. You will find a list of all these side effects published in fine print on the drug packaging. What does Ozempic have to say about this? Its parent company, Novo Nordisk, says these side effects are all well known. They're mild to moderate in severity and last for a short duration. Now, factually, all of this is correct. But here's what experts say. One of the side effects, stomach paralysis, for instance, has no cure. The tension in the stomach may not last for long, but its complications will. It causes dehydration, malnutrition, even vomiting. And this may be a mildly severe side effect for the company, but for those with a decrease in their life quality, it neither seems mild nor short-term. In some cases, the government has stepped in. Health departments are discouraging off-label prescription of this drug. They're urging doctors to halt prescribing it to new diabetic patients. But that may not be enough. Such demands do not solve the problem. Who is regulating the drug is the question. Who is making sure that these drugs are sold under strict conditions? Where are the health checks? Who is screening for eating disorders to check validity? A lot of questions, but no answer. And in some cases, governments have approved these drugs. So they've shoved accountability on patients, then wiped their hands off the matter. Now, regulation is absent, while drug-fueled TikTok challenges are taking place. This is where we are at.